Hello, my name is Nagendra. I am here on behalf of my 17 years old son, Dharan. He had a difficulty in swallowing, breathing, loss of bowel and bladder control. He could not even walk or stand by himself. He was admitted for GB syndrome with difficulty in walking, standing, breathing, and swallowing.
GB syndrome is a very rare disorder. One among a lakh people suffer from this disease. It's an autoimmune disorder. Autoimmune means your own immunity turning against your nerve cells and affecting the nerves. Within a week, it starts paralyzing your lower limb, then the upper limb, leading to full paralysis. The disorder affects every single part of the muscle, slowly going to the chest muscle and then to the respiratory muscle, causing respiratory failure, and that's the way patient dies.
We took him to top 3 hospitals in India, best in neurology. In spite of treatment from topmost specialists trying for more than 2 years and spent more than 30 lakhs resulting in no hope for the recovery. The doctors had completely lost hopes in his survival and had declared that there was nothing more they could do for him. I shared about my son's conditions with my boss, who recommended Dr. Batra's.
When the patient was brought to me, it was in a very serious condition. The case was deteriorating at 20 to 30% every month, and his motor and sensory functions were deteriorating day by day. He was not able to walk, he was not able to talk, and he couldn't even stand. So they brought him in their arms.
Same day when I admitted my son in ICU, there was an unsuccessful case of a 24-year-old boy who was treated for 6 months for GB syndrome and he lost his life. Looking at the situation, I was so worried about my son's life.
In this case, I went through each and every cranial assessment, nerve assessment. I did all the tests that I need to understand about the case. I understood that this is a very severe case of GB syndrome. After doing a detailed analysis of this case, I understood it needs 3 phases of treatment: medicine, motivation, and neurological activities. I prescribed conium maculatum as a specific drug which helps ascending paralysis, and Silesia as a constitutional medicine. To my surprise, in 3 months, he could stand, speak, and by 4th month, his renal parameters were better, so his dialysis support stopped, and by 6th month, he could breathe normally without AR support. By 8th month, he could walk and do his daily activities independently.
Within 3 months of medications, we started seeing improvements in Dharan's condition. He was able to do his daily activities and in 6 months, he started writing and walking. He is now independent doing his daily routine. Thank you, Dr. Daniel sir. Thank you, Dr. Batras, for giving a new life to my son. Jai Hind, sir.
Medicines I have taken from 6 months are so useful, and there are a lot of improvements also. I can walk distance more than before, and I'm not at all tired like before.
As a doctor, I'm so happy to see my patient who was in a zero state of life in bed, but now is jogging, running, doing exercise, and especially studying just like any other youngsters. Thanks to homeopathy, thanks to Dr. Batra's, healing people, changing life. We at Dr. Batra's believe in